Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined by Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we're announcing 12 additional deaths due to COVID-19. This includes a female in her 60s from Southern Health Santé Sud, linked to the outbreak at Health Science Centre at GA3. A female in her 70s from Southern Health Santé Sud. A male in his 70s from Prairie Mountain Health Region, linked to the outbreak at Grandview Personal Care Home. A female in her 70s from Interlake Health. A female in her 70s from the Winnipeg Health Region. A male in his 80s from Winnipeg Health Region, linked to the outbreak at Golden Link Lodge. A female in her 80s from Northern Health Region, linked to the outbreak at the acute care inpatient unit at the PA Health Complex, St. Anthony's General Hospital. A female in her 80s from the Winnipeg Health Region. A female in her 80s from the Winnipeg Health Region. A male in his 80s from the Winnipeg Health Region. A male in his 90s from the Winnipeg Health Region, linked to the outbreak at St. Norbert Personal Care Home. A male in his 90s from Northern Health Region. I'd like to extend our condolences to their family, their loved ones, their caregivers. And again, these are all Manitobans lost to us. Our current 5-day COVID-19 test positivity rate is 13.7% provincially, 14.6% in Winnipeg. 325 new cases of the virus have been identified as of 9:30 a.m. I want to remind everyone to go for testing only when you're symptomatic, when you have symptoms of COVID-19, and these symptoms include fevers, chills, cough, sore throat, hoarse voice, difficulty breathing, loss of taste or smell, vomiting, diarrhea greater than 24 hours, nausea, loss of appetite, runny nose, muscle aches, fatigue, pink eye, headache, unexplained skin rash, could include poor feeding of an infant. So again, we want people attending our test sites only if you've been directed to by public health or if you have any of those symptoms. You'll see that a number of active cases is down significantly. We've been making a number of process improvements and technology improvements over the past several weeks. This work has strengthened our overall case and contact tracing ability and better able to meet the current demands and catch up with some of the outstanding activities. So every daily bulletin has a report of active cases, which is intended to reflect the number of cases actively isolating, either in the community or in hospital. Starting today, we've made changes to improve the accuracy of that information. We've reviewed older cases and closed a number of them more accurately to reflect that those individuals have recovered. This has allowed us to remove more than 4,000 cases from active and list them as recovered. We'll also be making similar adjustment to contacts associated with these 4,000 cases. In addition to these adjustments, the auto-dialing system is also showing results, successfully closing more than 43% of cases contacted using this approach. Going forward, we've also made changes to the provincial reporting system, so we are able to monitor and correct any inconsistencies on a regular basis. This process will allow for more accurate reporting of active case in the daily bulletin and online. We'll continue to improve our contact tracing and case investigation processes over the next weeks. This includes strengthening our team through relationships with organizations like Stats Canada and the Canadian Red Cross, as well as technology to support key monitoring and support processes for cases and contacts. I note that these steps also led to a reduction in number of hospitalizations that we're reporting. Again, we're reporting on, in this manner, those COVID-19 hospitalization ICU numbers that reflect the people who are considered infectious. That had been the case from the start, but if we ran into some of the backlog as we've described in the past on that manner. We're going to look for other ways to share the type of information that includes a total number of people in hospital with COVID, not only the infectious individuals as well. Continuing to remind Manitobans to stay home as much as possible. Our case numbers remain too high to sustain. There's still too much strain on our healthcare system. We need to stay home as much as possible, going out only for essential reasons. Stay home certainly if you're ill. The bulletin lists a public exposure at a funeral on November 27th, and this was a COVID positive individual attended a funeral during the infectious period. People who attended that funeral need to self-isolate and call a local health center for further instructions. Again, we know this is the type of circumstances where we can see large amounts of spread of the virus. And that's close, prolonged contacts, especially with somebody who's symptomatic and test positive for COVID. Hanukkah starts this week and Christmas is getting closer. So we definitely want to have that clear message that we're discouraging all non-essential travel within and between provinces at this time. We want people to connect with family and friends by phone or other virtual means. Travel to and from northern Manitoba is restricted. This also extends to the snowbirds or those who annually leave to the United States for winter. Canadian citizens and permanent residents are advised to avoid all non-essential travel outside of Canada, avoid all cruise ship travel outside of Canada until further notice. While COVID-19 can make anyone sick, older Canadians are one of the groups at the highest risk for developing severe outcomes. Best way to protect yourself and your family and those most at risk of severe illness is to stay in Canada, and for the time being to stay home as much as possible. If you have travel plans, I suggest you contact your airline or tour operator to determine options for canceling or postponing your trip. Restrictions are changing quickly and may be imposed on countries with little warning. Your travel plans could be severely disrupted. Should you choose to take non-essential travel outside of Canada, you may be forced to remain outside of Canada longer than expected. It's important to remember that if you choose to travel abroad, your trip may become much longer than you planned. You may have reduced access to quality health care. You could be subject to the measures of other countries. If you must travel, please visit the Government of Canada's Travel Advice and Advisories page for your destination and regularly verify this travel health recommendations. During this pandemic, it's challenging for us all. We all need to make sacrifices. We need to change how we do things normally during this time. It won't be like this forever, but it is this way now. We all recognize how hard this is, especially during this upcoming season, but it's definitely necessary. You can see from the strain on our healthcare system that we can't keep these numbers up. So that message is clear: to stay home as much as possible, to follow those fundamentals that we've been discussing for quite some time, to go out only when essential, sending the least amount of people from your house out for those essential reasons. And we know that's the best way that we can limit the spread of this virus. So thanks, and I'll pass it over to Lanette.
Thank you. Hello, everyone. The work to refine the data has allowed us to present a more accurate picture of the virus-related hospitalizations. We had 310 individuals in hospital due to COVID-19 this morning. Our critical care program was at 160% of normal pre-COVID activity. As of midnight, 115 patients were in our ICUs, with 39 of those individuals having COVID-19. 33 of the 80 patients on ventilators this morning also have COVID. With regards to the hospitalization data, it reflects the number of people who are considered infectious and we are continuing to work to provide additional data that will detail those who are in hospital with COVID but are no longer infectious, and we hope to have something for you in the near future. The improvement in the quality of this data should not be mistaken as a sign that we can relax. Our hospitalizations and ICU numbers are still far higher than we would like them to be, and they're increasing at a pace that is really unsustainable. We need to continue to do all that we can to curb the spread of this virus. As of this morning, Public Health is reporting outbreaks at 48 personal care homes in Manitoba. There are significant outbreaks at a number of PCHs in Winnipeg, as well as at the Fairview in Brandon, and Fairview Care Home in Brandon, and the Grandview Care Home. Regional health authorities are deploying and reassigning staff from within the community sector, including those who work in home care, in order to stabilize staffing at these care homes. The Red Cross is also providing support to various sites, and paramedics continue to be available, stationed right now at Fairview Care Home in Brandon as part of the rapid response plan, and a paramedic is also available at Grandview on an as-needed basis to assist the staff. I can also provide an update on the number of positive healthcare workers, positive cases. In the past week, 73 healthcare workers tested positive for COVID-19, and 1,229 workers were tested. The 73 positive tests include 43 individuals from the Winnipeg Regional Health Authority, 13 from Prairie Mountain Health, 6 from Southern Health Sante Sud, 6 from Northern Health, and 5 from Interlake Eastern. Broken down by profession, this past week's numbers include 2 physicians or physicians in training, 29 nurses, 39 allied health or support staff, 1 paramedic, and 2 who have yet to be identified. Additionally, more work to address a data backlog has been ongoing and uncovered an additional 125 positive cases involving healthcare workers since the start of the pandemic. That brings our overall number of cases since March to 981. We are continuing to also see a high level of sick time amongst healthcare professionals within the Winnipeg Regional Health Authority. Approximately 113,000 hours were lost to sick time, and this is within the last 2 weeks, which is slightly up from 2 weeks prior to that. And the increased number accounts for those who are isolating after exposure, as well as those who have symptoms and are unable to work. To give you some perspective on these numbers, 113,000 hours of sick time lost amounts to nearly 7,100 8-hour shifts per week. Compared to our 5-year average for this pay period, it amounts to an additional 2,000 shifts per week that have been lost to sick time. This obviously creates an incredible challenge for us as we try to manage the pandemic and the demands. We also continue to take all the steps possible to make it easier for staff to get tested. A reminder that we have the RotorGene test that is in use at Health Science Centre and also available for the St. Boniface staff, which can give results within 4 to 6 hours. This allows symptomatic healthcare workers to get results quickly, and if they test negative, can return them to work safely. We've also set aside appointment spaces specifically for healthcare workers and our first responders at our testing sites on Pembina Highway and St. Mary's Road. And the dedicated testing site at the Winnipeg Fire and Paramedic Training Academy is piloting the use of rapid testing on symptomatic individuals using the Abbott ID Now device, which provides results in as little as 10 minutes. In the first 2 weeks, 148 first responders and paramedics have been tested at the site, and rapid test results using the Abbott are being verified in conjunction with the conventional nasal swabs that are going to CADM lab. And with that, we can open up the line to questions.
Thank you. A reminder to our reporters on the line this afternoon, you will have one preliminary and one follow-up question. Up first this afternoon from CBC Manitoba, Ian.
Good afternoon. We are seeing more fines for drive-in church services, yet we're seeing big lineups to look for Christmas lights. We have a vehicle rally to support farmers in India. Ultimately, why are these examples of long lineups and people in vehicles, why is that allowed to continue?
Yeah, so it's a question that we've been getting from the beginning about retail and things. I guess there's just no analogy between retail and for instance, a faith-based gathering. Right, in retail, yes, there might be many cars in the parking lot. Yes, there could be a number of people in the store at the same time, but they're not all there together for a prolonged period for that entire time. And so, if we look at the evidence that's now 9 months in the making, we don't see spreader events happen very commonly in retail settings. Certainly, we need occupancy restrictions in there. But we see super spreader events very frequently at faith-based gatherings, and it shouldn't come as a surprise because this virus is spread with prolonged indoor contact. And so I can't speak to enforcement of specific rallies. That will be up to the enforcement side of things on what they're addressing in that aspect. But so I would say that if we have a large amount of people gathering for a long period of time, that increases the risk. Certainly if everyone stays in their car the entire time, if it's only household members within that car for the whole time, and then that dramatically reduces the risk. So these are things that we're looking at, but we were in a critical stage. We were in a critical stage where we needed to ensure that we turn these numbers around. We've seen some aspect of that, but we tried the incrementality. Right, we saw our numbers going up. We tried the incrementality with the levels of orange and even with the level of red, but we remained on a critical path. So we just had to put in very strict restrictions, very hopefully limited time, because we had to get those numbers down.
Thank you. This is for Lanette. We see a pretty noticeable drop in hospitalizations. It's around 30. Does this drop represent actual discharges from hospital, or is this patients going past the infectious period and thus they're no longer being counted in the COVID numbers?
I believe it is the latter, Ian. So more work is going to be done now to look at those patients who are past the infectious period but still in hospital with the lingering effects of COVID. So we'll be able to get that information to you hopefully soon.
From the Canadian Press, Steve.
Good afternoon. Dr. Roussin, we're hearing more about a vaccine perhaps being approved quickly. Is Manitoba in a position in terms of ultra-low temperature storage capacity to accept a vaccine, say from Pfizer or somebody in the coming days?
Yes. Yep. So we are prepared to receive vaccine. Really, at any point now, should it be approved and should it be shipped to us, and we are in a position to begin administering vaccine if necessary, if that opportunity becomes avails itself to us.
Okay, and I have a question about the test positivity rate. We're seeing the case numbers stabilize at a lower point than they were sometime after very strict restrictions were in place. But the test positivity rate is still very, very high. And I'm wondering, when do you think that should be dropping, given the restrictions that are in place?
Yeah, and so, usually when we use that one incubation period to give us a good sense of what the effect of those restrictions will have. And so we're beyond the point where we're expecting to see that decrease in test positivity. You saw in the modeling study that it certainly was fairly clear that the trajectory has changed due to the restrictions. But we're still, counting on these restrictions to start bringing down that positivity rate in the near future.
From CTV Winnipeg, Mason.
Hi there. Rivera's internal review into the first wave of the pandemic in Ontario cites a lack of routine surveillance testing as one of the factors that allowed the virus to flourish in long-term care homes. My question is, why hasn't Manitoba started doing this yet in its long-term care home, and when can we expect to see that change?
Yeah, so we just received that report, so we'll definitely be reviewing that report. It should be clear that we do asymptomatic testing in our personal care homes, as part of a outbreak investigation. So we do a lot of asymptomatic testing. We don't have routine surveillance testing happening at this point. We're focusing our testing, up to now on the highest risk, those that are symptomatic, those that are part of the outbreak, so we could focus our resources. But I can tell you that we do have plans to start piloting more of a routine surveillance in certain settings like personal care homes, and we'll have more information on that when we can get that underway.
And how many of the 249,000 doses of COVID-19 vaccine announced today is Manitoba getting?
Yeah, we don't have anything confirmed at this point, so we will be able to receive anything shipped to us and be able to implement a program.
From City News, Jonas.
Good afternoon, folks. Ms. Siragusa, I just want to follow up with you on the personal care home situation. You mentioned there's a couple with significant outbreaks. Are these new care homes? Any information, I guess, on that?
There are 5 or 6 that have higher volume outbreaks in Winnipeg, and we've been watching them closely for several weeks, trying to work with the PCHs to put everything we can into effect to minimize the spread and keep the residents and staff safe. So we continue to watch all based on the testing of staff and of residents, and so it's really about 6 are the high volume ones in Winnipeg.
Thank you for that. Dr. Roussin, when it comes to vaccine arrival, have you guys established your rollout plans yet? Has that been established now that it looks like it is on the way?
Yeah, we are, still working on that. We don't have, everything set. We do have a good idea on if we do receive these early vaccines, how we'd roll that out. So remember that if we receive vaccine in the near future, this is going to be very limited in quantity. So it's going to be a very limited rollout for these early doses. And then even into the new year, we're expecting very scarce resources or scarce quantities. So we'll have very strict criteria that we'll have to follow. And so I think it's, the sooner we're able to receive vaccine, the better. So we're certainly prepared to receive vaccine at any time now, but we just need to, set up the expectations that this is going to be a very limited supply, especially early on, and so it'll be very minimal scope on who we can immunize with it.
From CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, will you be meeting with religious leaders about the new public health orders?
I do. I would like that opportunity to have a discussion and just run by some of the thoughts with the new orders and to hear some concerns. So that is something that I'd like to do.
And I know you can't tell me what the changes are, but could there be changes coming when it comes to religious services and the public health orders?
Yeah, you know what? We're going to be announcing that in the near future. So I'll just leave the details to that time.
From the Winnipeg Free Press, Larry.
Yes, Dr. Roussin, we're still seeing fairly high numbers of people testing positive for COVID-19, 325 today, almost 200 in Winnipeg. Why are we not seeing a big drop given that we've had code red restrictions for several weeks now?
Yeah, and I don't know if anyone could say the absolute reason. It's probably many reasons. One of which is that we're just in a well-established second wave, and so you look around us, we see case counts climbing in essentially every jurisdiction in Canada, and ours was climbing as well. Our restrictions have managed to change that trajectory, at least in the short term. So I think that these restrictions have made a difference. We were obviously expecting them to go down further. That was the goal. Again, not to eradicate it, but to get it into a much more manageable level. But if you look what's happening around us, and if you look at what our modeling data showed, we did get some significant benefit from these restrictions. We would be in a much worse spot right now. And so we'll just have to keep getting the message out. Keep on with our public health interventions of case identification, isolation, contact isolation, and to keep trying to get these numbers further down.
I'm wondering if, we've had a pretty broad-based approach, code red, applying right across the board. Is there a more targeted approach needed? Can you talk about is it lower income groups or is it certain communities? Where are we getting the spread? Is it all community transmission? Is it certain areas that the authorities need to focus on more? And what would those areas be?
So we are seeing that, Larry, in the downtown and Point Douglas area. So those are seeing a larger proportion of cases, and a lot of that does have to deal with things like homelessness and a sheltered population and lower income quintiles, which face many obstacles. And so we are trying to find ways to target those groups to help out better address the challenges that are more unique in those circumstances. So we are working on many factors there.
From Global, Brittany.
Good afternoon, Brittany from Global. Dr. Roussin, I think people are still a little confused as to where we're seeing all of these cases come from. I know you've talked about we've got such extensive community transmission, but with everything being closed, schools remain open, where are we seeing these new cases originating from? Can you give us a bit more details on where they're coming from?
Well, so a lot of them are household transmission. So we're seeing, large multi-generational households. We're seeing crowded household conditions where we're seeing a lot of cases that way. We are seeing some transmission in workplaces as well. And then, a number of just linkages that we can't make right now. So we are seeing that widespread community transmission. We are seeing it now, certainly in Winnipeg, affecting those lower income quintiles, which for a variety of factors, transmission is going in the wrong direction in those areas.
Thank you. And can you give us some more information on the vaccine storage, where that's going to be and who exactly is going to be doing the immunizing?
So we're going to be able to provide some more specifics on that. As you're aware that the Pfizer vaccine has some very difficult storage requirements, minus 80, so we are prepared for that. But we'll look to have a bit more detailed rollout of our plan in the near future.
From the Brandon Sun, Kyle.
Good afternoon. My question is about Grandview Health Center, which closed down on November 26th so that the staff there could help out for the outbreak at the nearby personal care home. I was wondering if any of you guys could provide an update on the status of the Grandview Health Center, like if you expect it to reopen in the not too distant future.
I haven't received an update today. I did last week, and it sounded like things were stabilizing there, and there was great support from the community. But we can follow up and get back to you on more details.
All right, thank you. And at this point in the week, what do you guys think the probability of moving Code Red into the rest of December past the minimal dates of December 11th?
Yeah, so we're going to be announcing the details of our the next public health restrictions this week, and so we'll provide all that detail then.
From CJOB, Will.
Good afternoon, everybody. Dr. Roussin, a substantial drop in the number of active cases today. You explained why off the top. I'm just wondering, that number we're seeing today, what's the margin of error on that? Is there still a bit of a backlog, and how much roughly?
That's right. Yeah. So we still have a number of cases that are listed as active that are not. So we have about 5,400 that are listed as active, and that number is probably closer to the 3,500 level. That's just a round estimate. We look at people who are recovered mostly 10 days after symptom onset. So if you take sort of the 10-day rolling average, that's a real rough estimate of how many active cases we have. Certainly people in hospital may be on that active list longer, but that's a rough number.
Okay, thank you for that. We've been talking a lot about a vaccine today. I'm just wondering, is there a sense of urgency right now to get numbers down so that the public health nurses that are doing contact tracing can begin immunizing when that starts?
Well, I mean, there's been a lot of urgency on getting these numbers down for a lot of reasons. One is just the demand on our healthcare system and the overall morbidity and mortality that we see from the cases. So that's the number one reason. But yes, our public health nurses are busy doing contact tracing, and there's other things that our public health nurses are experts in that are being challenged, right? Like following up of, say, sexually transmitted and bloodborne infections, or routine vaccination programs, and now a very large vaccine program. So yeah, there's lots of reasons to get these numbers down.
From the Winnipeg Sun, Scott.
Hi, good afternoon to you both. Scott Billick here, Winnipeg Sun. Question about the numbers in the Hanover-Steinbach area. They seem to have dropped quite significantly since the schools were shut down in that area. They went to remote learning, was I guess a couple of weeks ago now. Have you seen any correlation between those numbers and that? Is there a tangible effect that you've seen from shutting down those schools, and that effect that it's had on either bringing down case counts in the area?
Yeah, so it's certainly the timing. They've corresponded in the timing, but not in how we would understand the transmission of the virus. So when we put those restrictions on, it appears that the numbers were peaking in that area, and then we've seen a decline soon after shutting schools. So again, when we make a public health intervention, we don't usually expect any results from that intervention for 2 weeks. So the decline certainly preceded that timing. So I think a lot of it was the messaging about how high those numbers were, the need to suspend classes for that time, all contributed to the I think public health or the public's buy-in to the public health advice. So we are seeing some improvement in there. So we're continuing to watch that area.
Thanks for that. Last week in Ontario, they released a large amount of information on the location of transmission of cases, and one of it was, I think it was 0.1% of cases coming from retail. Are there any plans here to do the same? And do we know how many cases of COVID can be linked to retail or restaurants, bars, that sort of thing? Obviously not a lot lately, but is there any chance that data is coming down the pipe?
We do have some numbers. So we have numbers here. Of course, we have a lot of information from the literature and research on these settings as well. So it's really, you're not going to see transmission in certain settings everywhere but here. And so we have a lot of information to show, where the most transmission comes in, what kind of venues that is. So we can look to try to release some of that. Again, when you have very high community-based transmission, you're missing a lot of those links. So you're reporting on a certain percentage or a certain proportion of cases being identified in a certain area. But if you have a large proportion of cases that you don't know where they are from, you have to take those type of reports with a grain of salt. And so we do have information on that. But like I said, we have plenty of information from the research, from the literature to tell us where the high-risk settings are.
From CBC Radio Canada, Thibault.
Hi, good afternoon. I have a question because I'd like some clarification regarding the driving schools. Currently, some are open, others are not. Can you tell us if they are still allowed actually to operate? And if yes, what would be your recommendation to prevent the spread of the disease when you take driving lessons?
Yeah, and so the driving the schools have been operating. They're not expressly prohibited in the orders. Again, this is minimal contact. It's one-on-one, so it's less risk for these super spreader events with it. Right now, our message is to stay home and to go out only when essential. And so the message is clear for these type of things. So, certainly everyone should stay home if they're ill, would wear a mask. But we would suggest the only people that should be in your car are members of your household. And for the most part, stay home unless it's essential to leave. We're at a real critical point right now. So, like I said, it's very difficult to write orders that address every possible circumstance. But we can message clearly, and that message is clear, is stay home unless it's absolutely essential for you to go. And that's the message we're sticking to.
Okay, thank you. My other question is that I think last week, in the past few days, we had people in their 20s who died. Do you have any information regarding them? Do they have underlying conditions, something?
Yeah, so I mean, they did have underlying conditions, but again, when we're talking about that, I think that there's been too much emphasis on this. To lessen the impact of these kind of deaths, or all our deaths. Underlying conditions, it doesn't mean that these people were already horrendously ill and were on a path to dying. Think about how many people in their 20s or 30s, and as you go up, it's more common, that have an underlying condition. Like what proportion of Manitobans over age 50 or 60 have hypertension? That's a very high proportion. There's people in their 20s and younger who have asthma. That would be counted as an underlying condition, but it doesn't minimize in any way the loss of those people. So we have to be careful when we're talking about these underlying conditions.
From the Globe and Mail, Shannon.
Good afternoon. This question is for Lanette. What is the total number of surgeries that have been canceled or delayed to date?
Let me see if I have that. So we stopped reporting the canceled surgeries because it wasn't really reflective of the actual numbers that we would have. The surgeons know that we have decreased services, so they're not booking the cases as they were earlier in November. But if we look at month-to-month comparison from November this year to November last year, we estimate that approximately 2,300 non-urgent and elective surgeries have been postponed since October 26th.
Sure, thank you. My second question also pertains to this. Back in August, 2 private and 3 public healthcare facilities were awarded contracts to deal with a surgical backlog. How many previously canceled or delayed surgeries have been completed by those 5 facilities, and when do you think the backlog might be caught up in total?
Yeah, I don't have that number in front of me, but I certainly can get it for you. We did not catch up to what was delayed in the spring completely, but there was some advancements made. But I can get those specific details for you and get back to you.
Thank you. We have time this afternoon for just a few more questions. Please proceed.
Dr. Roussin, Scott Billick here from the Sun. How will vaccinations work for people who have already had a confirmed case of COVID-19? Will they, obviously, I assume they'll still be offered it, but do they need it, I suppose is maybe the question?
You know, it's a really good question, and we're still at our expert committees nationally, still looking at what the vaccine rollout will look like. You know, what sort of priority people, you know, that maybe fall in a priority group already who have recovered from infection would have. So that's a question that's still, that we're still looking into.
Dr. Roussin, Larry.
Dr. Roussin, what day this week do you
I'm wondering if you could give us some information, or when will we get information released? I think you've promised it a few times in the past about statistics on infection rates among certain groups, certain perhaps low-income groups. When are we going to see that kind of information?
Yeah. So I don't have a date, but I do. That is something that's being worked on. But I can't give you a date on that. But I do. We'll get back to you. I hope to have something on that soon.
Dr. Roussin, can you tell us when this week we can expect to see the new public health orders?
Yeah, it'll be this. Obviously, it'll be this week sometime. I don't want to. There's a lot of sort of work on it going on, so I don't want to commit to a certain day. But it'll be early this week.
Do we have a test positivity rate for the Steinbach and Hanover regions?
I don't have an updated one. Last week it was declining. It was still in the lower 30s, but I don't have an updated one for this week.
For the new public health orders, when they do come in, are they going to last 2 weeks, or are they going to be longer than that?
Yeah, we're still gonna. We'll announce all the details when as a package. Hopefully earlier this week.
Can you share what work still needs to be done on readiness for the vaccine? What do we still need to do as a province?
Well, I mean, it's we've got a lot of work done. A lot of the logistics are in place. It's just a lot of the details now, and what it's a challenge, right? So this is going to be a huge undertaking, and we know that early on we're going to have very scarce resources, so we have to finalize the sequencing of this. We have to still look at some of the logistics on that. But we're quite a far ways ahead, and we hope to be able to provide some details on that in the near future.
Dr. Roussin, it's Jonas from Citi. Just a quick follow-up on that. Would it be safe to assume that personal care homes will be top of the list?
Well, it's certainly those are listed as a priority group. So we'll talk about people living in long-term care facilities is going to be in the priority group. How things are sequenced, it's going to depend a lot on logistics and availability, and we'll have more details on that very soon.
Dr. Roussin, Scott here again from the Sun. Students are going to get roughly a month off from classes coming up here. If you see a dramatic decrease in cases and across the province, I suppose, over that month period, would there be consideration put into extending that remote learning period, or just at least giving parents the option to keep their kids out of school across the board from K to 12?
Well, I mean, we always consider things based on our epidemiology. So I can't speak to exactly what that is. We look at other jurisdictions. Other jurisdictions may keep their students in class when we have ours out. There's some right now that have their students out. So we're reviewing all this. So if we felt that there was a good evidence to extend it, then that's what public health would recommend.
Have you seen what's going on in Ontario? There was one school that had 250 kids that had to self-isolate because they found a few cases through asymptomatic testing. Does that lead you to believe that we're missing a lot of cases in students right now just because they aren't being tested asymptomatically?
Well, looking at a few examples like that, certainly we have to pay attention to it. It's not conclusive. We know that at a test positivity rate of 13%, that there's cases that aren't being tested, so that's absolute. And so we'll continue to follow things here.
Dr. Roussin, just on the lineups again, or I guess the church drive-in services, you referred to these faith gatherings being different than retail, but like a rally, lining up to see Christmas lights, those aren't retail activities. Are you saying that those type of events are similar to retail and that there is no, examples of spread?
Yeah, I mean, it depends on the circumstances. So a rally that included a lot of gathering, especially outside of the vehicles and stuff, that would be higher risk for transmission. So certainly public health would not be suggesting that those occur. As far as cars driving through where there's a less chance of people gathering, then that's probably even lower risk. And so we'll have these new orders and the details of these coming out early this week, and then we can further discuss where we're going forward.
Thanks, everyone, and that concludes this afternoon's media briefing.